What do Buddhism and modern science have in common? At first glance, these two areas of knowledge seem to belong to different worlds, an ancient religion with over 2,500 years of history and a systematic practice of empirical investigation based on evidence. However, as we explore fundamental concepts from both fields, a surprising convergence begins to emerge. Buddhism, with its teachings on the mind, suffering, and detachment, offers practices like meditation that have been studied and supported by scientific research in recent decades. But how exactly do these teachings relate to modern science? The aim of this video is to explore these intersections, showing how Buddhist principles, especially those related to meditation and detachment, are supported by recent findings in neuroscience, psychology, and other areas of science. Throughout this journey, we will explore how these two approaches can complement each other to promote well-being and reduce suffering. Buddhism is a spiritual tradition founded by Siddhartha Gautama, the Buddha, around the 6th century BCE. Its central goal is the pursuit of liberation from suffering, achieved through a deep understanding of the nature of the mind and reality. Two fundamental pillars of Buddhist doctrine are the Four Noble Truths and the Middle Way. The Four Noble Truths are the essence of Buddha's teachings. First, the truth of suffering. Life involves suffering, whether physical, mental, or emotional. Second, the truth of the cause of suffering. Suffering arises from desire, attachment, and ignorance. Third, the truth of the end of suffering. It is possible to end suffering by eliminating desire and attachment. Fourth, the truth of the path to the end of suffering. Suffering can be overcome through the middle way, also known as the Noble Eightfold Path, which involves ethical practices, meditation, and wisdom. Meditation and the concept of detachment are at the core of Buddhism as tools to help reduce suffering and achieve enlightenment. Meditation, in particular, is seen as a way to train the mind to be present and detach from the sources of attachment that cause pain. Modern science, particularly in the fields of psychology and neuroscience, has focused on understanding how the brain responds to suffering and desire. One of the fundamental systems involved in this process is the brain's reward system, which regulates our responses to pleasurable and painful stimuli. When we desire something, whether it's food, success, or validation, the brain releases dopamine, a chemical that makes us feel good. This mechanism motivates us to seek pleasurable experiences but also creates a cycle of dependence and attachment. This reward system aligns with the Buddhist view of suffering. In Buddhism, desire and attachment are seen as the main causes of suffering. When we intensely desire something, our mind clings to that desire, and if it's not fulfilled, we suffer. Even when we get what we want, the pleasure is temporary, and new desires quickly arise, perpetuating a cycle of dissatisfaction. This dynamic is reflected in neuroscience, which shows that the pleasure generated by dopamine is fleeting, leading the brain to constantly seek new stimuli to maintain a sense of well-being. Another important point of convergence between Buddhism and science is the impact of desire and attachment on mental health. Studies show that the constant pursuit of external rewards can increase stress, anxiety, and even contribute to depression. This happens because the more we rely on external factors for our happiness, the more vulnerable we become to the inevitable frustrations of life. Modern science, like Buddhism, is beginning to recognize that finding a way to detach from these cycles may be essential for psychological well-being. This understanding brings up a central point. Both neuroscience and Buddhism agree that suffering is not just in external events but in how the mind reacts to them. While science investigates the biochemical and neural workings of these processes, Buddhism has long offered a practical approach to dealing with desire and attachment, promoting a state of inner peace. Science has shown great interest in meditation over the past few decades, and the results are impressive. Studies reveal that regular meditation practice can bring a range of benefits to both the brain and body. One of the most significant findings is meditation's ability to alter the structure and functioning of the brain. Research using neuroimaging techniques, such as MRI, has shown that people who meditate regularly have a thicker cortex in areas of the brain associated with attention and emotional processing. This means that meditation can literally reconfigure the brain to be more efficient and resilient. A study conducted by Harvard Medical School found that mindfulness meditation can increase gray matter density in the hippocampus, a crucial area for learning and memory, and decrease the density of the amygdala, the region of the brain associated with stress and anxiety. This suggests that meditation can help reduce emotional reactivity, making it easier to respond more calmly and balanced to stressful situations. Meditation practice not only improves focus and concentration but can also lead to a state of greater tranquility and emotional control, a concept at the heart of Buddhism. Beyond mental effects, the physical benefits of meditation are also notable. Meditation has been linked to reduced blood pressure, a stronger immune system, and improved sleep quality. A study published in JAMA Internal Medicine showed that mindfulness meditation can be as effective as medication in treating chronic insomnia. Meditation has also proven effective in pain management. Patients who practice meditation regularly report feeling less pain, and brain scans show that their brains process pain differently, with less activation in areas associated with discomfort. This process of self-awareness and detachment is central to both Buddhist practice and modern mental health. By combining the principles of Buddhist meditation with scientific evidence, it becomes clear that meditation is an effective bridge between tradition and science. It offers a practical tool for dealing with the challenges of the modern mind while finding support in scientific discoveries that point to its effectiveness in shaping a healthier brain and a more balanced life. In Buddhism, attachment is considered one of the main causes of suffering. The Buddha taught that when we become attached to things, whether material objects, people, or ideas, we put ourselves in a vulnerable position because everything is impermanent. When what we're attached to changes or disappears, we inevitably experience suffering. Modern neuroscience is beginning to support this view, showing that excessive attachment can have negative consequences for the brain, especially concerning stress and anxiety. Studies show that the amygdala, a brain structure responsible for processing emotions like fear and anxiety, is strongly activated when we feel that something we are attached to is at risk. This increase in amygdala activity triggers a fight or flight response, raising stress levels and, over time, potentially harming mental health. Moreover, the prefrontal cortex, the part of the brain responsible for reasoning and decision-making, is also affected by attachment. When we are overly attached to something, this area can become less efficient, making it harder to make rational and balanced decisions. This happens because attachment causes us to react emotionally and impulsively, rather than evaluating the situation with clarity and logic. Another important point is the impact of attachment on human relationships. Neuroscience suggests that excessive attachment to people can lead to emotional dependency, which can trigger possessive and anxious behaviors. This not only harms the quality of relationships but also increases activity in brain areas related to anxiety and insecurity. However, the concept of detachment, in both Buddhism and neuroscience, doesn't mean indifference or lack of care. Detaching doesn't mean you stop loving or caring for others, rather, it's about freeing yourself from the need for control and the obsession with outcomes. In practice, this can reduce stress levels and help the brain function more effectively, allowing for a greater capacity to adapt to life's changes. The concept of mindfulness, a Buddhist practice, has gained significant attention in modern science, particularly in the field of mental health. Mindfulness refers to the ability to be fully present in the moment, with focused attention, without getting carried away by distractions or judgments. In Buddhism, this practice is seen as an effective way to reduce suffering, allowing the practitioner to observe their thoughts and emotions with detachment, without identifying with them. Research shows that mindfulness can change how the brain processes emotions, strengthening areas associated with attention control and reducing emotional reactivity. One of the main benefits of mindfulness is its ability to reduce repetitive thinking, a common factor in people who suffer from depression and anxiety. Regular mindfulness practice helps individuals break negative thinking cycles and adopt a more balanced approach to life's challenges. Studies also indicate that mindfulness can lower cortisol levels, the stress hormone, which directly reduces anxiety. By cultivating a more present and aware mind, individuals develop emotional resilience, becoming less susceptible to mood swings and excessive worries. Additionally, mindfulness is being integrated into clinical practices as a complement to conventional treatments. Research suggests that it can be as effective as antidepressant medications in preventing relapses in patients with recurrent depression. Thus, both Buddhism and modern science agree, mindfulness is a powerful practice for promoting mental health. By bringing attention to the present moment without judgment, we can learn to cope more effectively with life's emotional ups and downs, finding peace amidst the chaos. Recent studies have also begun to explore the effects of meditation on brain aging. Research indicates that regular meditation may slow down the process of brain degeneration, preserving cognitive functions for longer and even reducing the risk of neurodegenerative diseases such as Alzheimer's. This opens the door for meditation practices to be integrated into medical protocols in the future to promote longevity and quality of life. Moreover, mindfulness and meditation are becoming increasingly common tools in the workplace and schools. Companies and educational institutions are incorporating these practices to help people manage stress, improve focus, and boost productivity. In the future, we can expect mindfulness to become an integral part of many aspects of daily life, from education to public health. There is also growing interest in investigating the biological mechanisms underlying the mental and emotional changes promoted by meditation. The use of advanced neuroimaging and genomic technologies is helping scientists map the impacts of these practices on the brain and body, providing more concrete evidence of the benefits of meditation. The future looks promising for this intersection between Buddhism and science, as more research is being conducted to understand how these practices can be applied in even broader contexts, such as preventive medicine and the treatment of chronic diseases. Science and Buddhism are walking side by side, creating a collaboration that promises to bring increasingly effective and practical solutions to human suffering.